Hello everyone and welcome to our part 3 video in the nursing practice questions and answers series. Let's dive right in with question 1. Which skin disease is caused by a fungal infection? A. Vitiligo, B. Psoriasis, C. Eczema, D. Ringworm. Vitiligo is a loss of skin pigments. However, it is not infectious. Psoriasis is an autoimmune condition that causes red scaly patches, and it is usually not caused by a fungi. Eczema is an inflammatory skin condition, and it is often related to allergies or irritants and not a fungus. Ringworm is a fungal infection. It is also called a tinea. It is a fungal infection of the skin that causes ring-shaped red itchy patches. So based on those options, our answer is option D, ringworm. It is caused by a fungal infection. Question 2. Which genetic disorder affects the ability of the blood to carry oxygen properly? A. Hemophilia, B. Huntington's disease, C. Sickle cell anemia, D. Cystic fibrosis. Hemophilia affects blood clotting and not oxygen transportation in the blood. Huntington's disease affects the neurological function in the body, but not blood or oxygen. Sickle cell anemia is a genetic disorder where the red blood cells become abnormally shaped. They become sickle shaped. While cystic fibrosis affects the lungs and the digestive system, but not the red blood cells directly. So our answer here is option C. Now, because the cells are sickle shaped, they cannot carry oxygen efficiently and they can even block blood flow, leading to pain and organ damage. Question 3. Which disease is characterized by loss of memory and cognitive decline? A. Epilepsy, B. Multiple sclerosis, C. Alzheimer's disease, D. Parkinson's disease. Epilepsy is a neurological disorder and it is characterized by recurrent seizures, not actually memory loss. Multiple sclerosis causes nerve damage, and this leads to muscle weakness, vision problems. It also leads to coordination issues, but it doesn't necessarily affect memory loss. Alzheimer's disease is a progressive neurodegenerative disorder, and it primarily affects memory, thinking, and cognitive function. It is also one of the most common causes of dementia in older adults. Parkinson's disease primarily affects movements, and cognitive decline can actually occur, but that occurs in later stages. So, based on the options, the disease that is characterized by loss of memory and cognitive decline is option C, Alzheimer's disease. Question 4. What can happen if a gallstone blocks the common bile ducts? A. Jaundice, B. Increased urination, C. Weight gain, D. Decreased appetite. Now let's look at the various options. The common bile duct carries bile from the liver and gallbladder to the small intestine. So if a gallstone blocks this duct, bile will not be able to flow normally. This will cause bile pigments, especially bilirubin, to build up in the bloodstream, and this can lead to jaundice. Jaundice is usually characterized by yellowing of the eyes and the skin. In option B, increased urination is not directly related to gallstone blockage. Weight gain is also not a typical consequence. And while decreased appetite may occur as a secondary symptom, based on the option, jaundice is the direct effects of when a gallstone blocks the common bile duct. So our answer here is option A. Question 5. Which artery supplies blood to the brain? A. Femoral artery. B. Pulmonary artery. C. Carotid artery. D. Radial artery. The femoral artery supplies blood to the legs, so that's not our answer. The pulmonary artery carries deoxygenated blood from the heart to the lungs. The carotid arteries are the major blood vessels that supplies oxygenated blood to the brain, neck, and face. So we have the left and right carotid arteries, and each of them divides into an internal carotid artery, which goes to the brain, and also an external carotid artery, which supplies blood to the face and the scalp. The radial artery supplies blood to the forearm and the hand. So out of these options, the artery that supplies blood to the brain is the carotid artery. Question 6. Which type of joint is the shoulder joint? A. Ball and socket joint. B. Hinge joint. C. Pivot joint. D. Gliding joint. The shoulder joint consists of the head of the humerus, which is like a ball, fitting into the glenoid cavity of the scapula, which is like a socket. So the shoulder joints, the type of joint that is found in the shoulder is the ball and socket joint. Now, this structure allows for multi-directional movements. So you can rotate your arm, you can abduct your arm, you can adduct your arm. It allows flexion and extension as well. The hinge joint allows movement in only one plane. So, for instance, the elbow joint or the knee joint, these are hinge joints. The pivot joint allows only rotational movement. So, for instance, you have the neck. The neck joint is a pivot joint because you can only uh, move your head in a rotational manner. The gliding joint allows for sliding movements. So, for example, the wrist bones, you have the gliding joints in the wrist bones. So, out of these options, our answer is option A. The shoulder joints is the ball and socket joints. Question 7. What are the bones that make up the fingers called? A. Carpals. B. Tarsals. C. Metacarpals. D. Phalanges. Carpals are the bones of the wrists. Tarsals are bones of the ankle. Metacarpals are bones of the hand between the wrists and the fingers, while phalanges are the bones that makes up the fingers and the toes. So each finger has three phalanges, which is the proximal, the middle, and the distal, except for the thumb. The thumb has just two phalanges. So out of these options, the bones that makes up the fingers are the phalanges, and that is option D. Question 8. Which bones articulates with the radius to form the elbow joint? A. Humerus. B. Ulna. C. Carpals. D. Metacarpals. The humerus is the upper arm bone, and in the elbow we can find the humerus, the radius, and the ulna. The elbow joint is formed by the articulation of these three bones. So the humerus, which is the upper arm bone, the radius, which is the lateral forearm bone, and the ulna, which is the medial forearm bone. The head of the radius articulates with the capitulum of the humerus, forming part of the elbow joint. Then the ulna also articulates with the humerus at the trochlea, which allows the hinge-like motion. The carpals are wrist bones. The metacarpals are the hand bones between the wrist and the fingers. So out of this, the bone that articulates with the radius to form the elbow joint is option A, the humerus. Question 9. Which disease causes white patches on the skin due to loss of melanin? A, dermatitis, B, psoriasis, C, vitiligo, D, eczema. Dermatitis is an inflammation of the skin which causes redness, itching, or rashes. Psoriasis is an autoimmune condition that causes red, scaly patches, but it doesn't cause a loss of pigment. Vitiligo is a skin condition where the melanocytes, which are the cells that produces melanin, are destroyed, thereby leading to white or depigmented patches on the skin. Eczema is an inflammatory skin condition that causes redness, itching, or irritation. So out of those options, our answer is option C, vitiligo. Question 10. Which viral infection is a primary cause of AIDS? A, hepatitis B, B, HIV, C, HPV, D, herpes simplex. Hepatitis B affects the liver and not the immune system. HIV, which is the human immunodeficiency virus, is a virus that attacks the immune system, leading to immunodeficiency. Now, AIDS, which is the acquired immunodeficiency syndrome, is the advanced stage of the HIV infection, and it is characterized by severe immune suppression and even opportunistic infections. HPV, which is a human papillomavirus, causes genital warts and cervical cancer, but not AIDS. Herpes simplex causes cold sores or genital herpes, but it doesn't cause AIDS. So the viral infection that is the primary cause of AIDS is option B. That is the human immunodeficiency virus or HIV. Question 11. Which disease causes weak and brittle bones due to calcium loss? A, rickets, B, scurvy, C, osteoporosis, D, osteoarthritis. Rickets is the softening of bones in children due to a lack of vitamin D. This leads to bone deformities. Scurvy is caused by a lack of vitamin C, and this leads to poor wound healing and bleeding gums. Osteoporosis is a condition where the bones lose density and strength, thereby becoming weak and brittle, and this is usually due to calcium and vitamin D deficiency. Osteoarthritis is a degenerative joint disease and it causes joint pain and stiffness, but not bone weakening. So our answer here is option C. Osteoporosis is caused due to a lack of or deficiency of calcium and vitamin D. Question 12. Rickets is caused by a deficiency of which vitamin? A, vitamin A, B, vitamin B12, C, vitamin C, D, vitamin D. Rickets is a disease in children that is characterized by soft, weak bones and skeletal deformities. Now, looking at the options, vitamin A is important for vision and immune function, but it doesn't cause a deficiency of it doesn't cause rickets. Vitamin B12 is important for red blood cell formation and nerve function, and a deficiency of it does not cause rickets. Vitamin C prevents scurvy and is essential for collagen formation. Vitamin D, on the other hand, is essential for calcium and phosphorus absorption in the body, and a deficiency of this is what causes rickets. So our answer here is option D. Question 13. What is the primary treatment for chronic obstructive pulmonary disease? A. Antibiotics. B. Oxygen therapy. C. Diuretics. D. Antihypertensives. Chronic obstructive pulmonary disease is a progressive lung disease that makes it difficult to breathe due to airflow obstruction. Now, the primary treatment for this is to improve the oxygen levels, which would go ahead to relieve the symptoms and slow the disease progression. So, for this disease, oxygen therapy is the main supportive treatment for patients that have this disease. It helps to maintain adequate oxygen in the bloodstream and reduces the workload on the heart and lungs. So, our answer here is option B, oxygen therapy. Question 14. What is the most common cause of pelvic inflammatory disease? A. Parasitic infection. B. Fungal infection. C. Bacterial infection. D. Viral infection. Pelvic inflammatory disease is most commonly caused by bacterial infections, especially sexually transmitted bacteria like the Chlamydia trachomatis. Chlamydia trachomatis. It affects the female reproductive organs like the uterus, fallopian tubes, and the ovaries, and it can lead to infertility, pelvic pain, or even ectopic pregnancy if left untreated. This disease is not caused by parasites or fungi or viruses. It is caused by bacteria. So our answer here is option C. It is a bacterial infection. Question 15. At what stage of pregnancy is gestational diabetes most commonly diagnosed? A. First trimester. B. Second trimester. C. Third trimester. D. Postpartum. Gestational diabetes usually develops when the hormonal changes of pregnancy causes insulin resistance, and this is usually around 24 to 28 weeks of gestation, which is the second trimester. So, screening is usually done with a glucose challenge test during this period. First trimester is too early to check for this, and by the third trimester, you can just continue to manage it at this point. In postpartum, the gestational diabetes usually resolves itself after delivery, although some women remain at higher risk for type 2 diabetes. So, this screening is or this diagnosis is usually done in the second trimester, and that is option B. Question 16. Which part of the body never grows? A. Heart. B. Brain. C. Eyeball. D. Kidney. In option A, the heart does grow and it increases in size as the body grows. The same thing goes for the brain. The brain grows rapidly in childhood, reaching about 90% of adult size by age 6. The eyeball, on the other hand, is considered to have a fixed size after birth, especially the cornea, which does not grow throughout the lifetime of a person. This is why the eyes of infants often appear to be large compared to the rest of their bodies. So we can just say they grow into their eyes, because the eyes doesn't grow. The kidneys also grows as the body matures. So out of this option, the part of the body that never grows is the eyeball, and that is option C. Question 17. What is the recommended daily intake of fiber for an adult? A, 10 to 15 grams. B, 30 to 35 grams. C, 20 to 25 grams. D, 40 to 45 grams. Dietary fiber is essential for healthy digestion, bowel regularity, and cholesterol control. It helps to prevent constipation and supports heart and gut health. So, the recommended daily intake of fiber for adults is approximately, for women, it is 21 to 25 grams, while for men, it is 30 to 38 grams. So, on an average, we can say that the recommended range for adults is about 20 to 25 grams daily, and that is option C. Question 18. At what gestational age should the first ultrasound be done in a normal pregnancy? A, 4 to 8 weeks. B, 7 to 9 weeks. C, 10 to 12 weeks. D, 16 to 18 weeks. At 4 to 6 weeks, an ultrasound may be done, but only if there are complications such as bleeding or a suspected ectopic pregnancy. At 7 to 9 weeks, a viability scan can be performed, but if only there are risk factors. It's not routine to perform a scan at 7 to 9 weeks. In a normal, uncomplicated pregnancy, the first routine ultrasound is typically done between 10 to 12 weeks of gestation. Now, this scan will help to confirm viability. It will help to determine the gestational age. It will help to detect multiple pregnancies as well as checking for major abnormalities. At 16 to 18 weeks, this is when the anomaly scan is done, um, but not the first ultrasound. So, in essence, first ultrasound, which is routine, is done at 10 to 12 weeks. Anomaly scan is done at 18 to 20 weeks, while the growth scan is done at 28 to 32 weeks. With respect to the question, our answer is option C, 10 to 12 weeks. Question 19. What is the primary cause of failure to thrive in infants? A, malnutrition. B, genetic disorder. C, infections. D, teething. Failure to thrive is usually defined as an inadequate physical growth in infants and children, and this is often diagnosed when their weight or height falls below the 5th percentile for their age. The common causes are malnutrition, which can be as a result of inadequate absorption due to celiac disease, increased metabolic needs such as chronic illnesses, or even inadequate caloric intake such as poor feeding or neglect. Genetic disorders can cause growth issues, but it is less common. Infections may also contribute, but these are just secondary causes. Teething is a temporary loss of appetite, and this may occur, but it is not the true cause of failure to thrive. So, based on this option, the best answer as the primary cause of failure to thrive in infants is option A, malnutrition. Question 20. What is the most appropriate treatment for a child with acute asthma attack? A, antihistamines. B, antibiotics. C, bronchodilators. D, intravenous fluids. Antihistamines are not useful in acute asthma. They are more useful for allergic reactions. Since asthma is not caused by bacterial infections, antibiotics will be inappropriate, except there is a secondary infection. The first-line treatment for an acute asthma attack in children is a rapid-acting bronchodilator such as salbutamol or albuterol. These drugs act quickly to relax the bronchial smooth muscles, thereby relieving bronchospasm and improving their airflow. Intravenous fluids may be supportive, but that is only if there is dehydration, but they don't actually treat the airway obstruction. So the correct answer here is option C, bronchodilators.